You can document to vital signs if it applies to your patient. And then under pain management interventions is where you're going to document how you're going to treat the pain that the patient has. The first three options have to do with medication, such as a single medication modality. You may have just given a Motrin. Multiple medication modality, you maybe gave a Motrin and a Percocet, or you're pre-medicating before any activities. As we move down, you're going to see more yellow, which you're not going to document to. This is the fall and safety. However, right below that is your interventions with your WDL. Each patient is given an appropriate intervention, such as universal, moderate, or high, depending on your patient's score that the nurse has assessed. If we move down to cardiac, you'll see your WDL. This is your normal cardiac parameter that you will document to. Cardiac rhythm will be for the nurse who is interpreting the EKG strips. You will start to see a series of green parameters. You will not document in the green either. This is from the plan of care. The peripheral neurovascular parameter is a little bit tricky. If the patient possibly has edema, you would choose WDL accept, click cancel. The confusing part is that each of the exceptions is actually separated. So you'll see how radial pulse, pedal pulses, and so forth. You'll want to jump down to the edema portion and document by left-clicking next to the 1+, 2+, and so forth, and the appropriate area. So your documentation would look like this, where it says WDL accept, and then it's a little bit broken apart. If your patient has any type of stockings or antiembolic interventions, you'll document here. Okay. Again, this flow sheet does auto-populate into the next menu. So if it doesn't apply to your patient, just simply click cancel and it will move you on to the next field. Here's your IV access. The actual WDL is now towards the top of this parameter, so you don't have to search so hard. And basically you will need to document to this one every 4 hours. That's our policy. I want to just point out here that under breath sounds, you'll notice it's separated yet again, but that is the exception portion. So the clear and equal bilateral breath sounds is actually in the WDL. So you would only document there if that's an exception. Again, you'll see that this flow sheet holds a lot of areas that you can document to for your patient. For your GI, there's your WDL, okay, whether it's defined or not. Again, if it's exceptions, you're just going to document to the line that is the exception. So maybe the vowel sounds are hypoactive in the left upper quadrant and right upper quadrant. And again, multi-select, so you can go ahead and document to as many options as you need to. If we move further down the flow sheet, you will see that we get to our genitourinary. If the patient has a catheter, this parameter will auto-populate based on an order for you to document to. If there are any items that need to be documented to that are not found, you need to speak to the primary nurse, as again, they are the only ones who can add those parameters to this flow sheet. Moving down to musculoskeletal, you're going to document to your WDL. There's also extremity movement. And under the interventions for musculoskeletal, you have activity. So if you assisted them with ambulation, if you performed ROM. Under the extremity movement, you can document to active or passive ROM. Here's your assistance with ambulation, if you had to use any assist. And then again, your ROM performed. Document to the ROM performed every time you do this. So as we are going through this flow sheet, you will be documenting a head to toe during your shift, and then you will be revisiting this flow sheet as care occurs. So you document what you do with your patient, or if their condition changes. If you notice, right underneath the Braden scale is your skin WDL. You can document to your patient's skin. Below that is your oral care assessment as it applies to the patient. And then underneath this is your skin intervention. So under hygiene care is your pick list of all the interventions you applied to your patient. So if you did any linen changes, if you provided a bed bath, if you shampooed, and if you required any assistance with this intervention. You have oral care again, any turning and positioning, pressure reduction devices, specialty beds, and so forth. Before you save your data or your assessment, you will need to assign a cosigner, which we will be going over next. Remember, your documentation is italicized until saved. So assigning a cosigner, I usually do at the end, so that I don't forget the necessary steps. You will locate your options panel on the left-hand side and choose Save Options. Open this menu, and you will notice that there's an area that says Cosigners. Once I click into that field, I will need to search for my nurse or my nursing instructor by clicking in the Other option and manually typing in under Care Provider the clinician's name. I will need to physically click on Search to locate them. Once I do, I will click OK, and you will notice that their name populates in that gray box. Then I can click Save. My documentation becomes unitalicized. Most importantly, go back to the left and uncheck the cosigner's name. You can click Save again if you need to. Again, this is only done for the ANI. This concludes the clinical documentation education. Thank you.